Hi everyone, thank you for joining. My name is Victoria Gray and I'm the World Stroke Organisation Campaign and Fundraising Manager. I'd like to welcome everyone who has supported World Stroke Day in the past and also those interested in taking part for the first time. We're really excited to share with you the new theme for 2016 and we hope this campaign will inspire your plans for World Stroke Day this year. The presentation itself will last around 30 minutes and it will include a 15-minute Q&A session at the end. We'll be joined by our guest presenters, our President, Professor Stephen Davis, and Director of Communications at Stroke Foundations Australia, Mary Ogle. Questions can be submitted via the chat box at the bottom of the screen, but please feel free to start submitting your questions at any time during the presentation. And we will either try to answer them right away or save them for the end. The presentation is divided into the following topics, including a background, World Stroke Day 2016 overview, and how to get involved, followed by an opportunity to ask questions. So let's start. I'd like to introduce you to our President, Professor Stephen Davis, and he'll give you an overview of the background of the World Stroke Day campaign and an introduction to the new theme. Thank you, Steve.
Well, thanks so much, Vicky and Mary, and welcome to everyone involved in this webinar. World Stroke Day is a major global event. It was instituted around 2006 by a previous president, Vladimir Hushinsky, and it grows from year to year. Every year we have it on October 29, and the theme, of course, the mission of the World Stroke Organisation is to use our education and advocacy on World Stroke Day to reduce the global impact of stroke through prevention, treatment and long-term care. So we work to reduce the impact of stroke on patients, carers, families and communities. There's really no one in the world who isn't in some way affected by stroke, either directly with a loved one or friend. Their campaign increases awareness of stroke risk and improves treatment and care. We believe that working together we can really make a difference. We have a massive global challenge, and this challenge is getting bigger and bigger every year. There are around 17 million new strokes every year, and these don't just affect old people, they affect young people as well. Stroke is a leading cause of disability, and unfortunately it's a major cause of death. Around 6.5 million deaths every year are attributable to stroke, and many of the 26 million survivors are affected in some way by stroke, physically or mentally, and importantly are at risk of further stroke. So we need to do more to tackle this global challenge. Our vision of the World Stroke Organisation is a life free of stroke. We know that we can never completely eradicate stroke, but we believe we can make a major impact. I would like to emphasise that a great deal, in fact, can be done in preventing stroke. We're going to talk mainly about treatment tonight, but stroke prevention is critically important, and we particularly want to emphasise that apart from treating risk factors for stroke such as high blood pressure, smoking and obesity, lack of physical inactivity, that public health campaigns are really, really important. So we're trying to tackle on a global level reducing salt, reducing excessive smoking, reducing smoking rather, stopping it, reducing salt and sugar intake, encouraging physical inactivity, and also countering air pollution. But let's move on to the theme for this year, Vicky. So we do have a brand new stroke theme called Face the Facts, Stroke is Treatable. And this theme is based on the fact that although we recognise the tremendous importance of prevention, which really we all need to be engaged with. But unfortunately, with 17 million new strokes around the world, and really a stroke epidemic in low and income and developing countries, we've got to focus on the treatable nature of stroke, because lives can improve with better action, access, and of course, chiefly awareness. So this is the theme, the treatable nature of stroke, and you'll see that all of these materials are available for download from our World Stroke Campaign website. So, although stroke is a complex medical issue, there are ways to significantly reduce its impact. We're going to talk about some of the key things that can be done in improving the outcome for any stroke patient, but very importantly, recognising the signs of stroke early, treating stroke as a medical emergency, and universally having the ability to admit our patients to a specialised stroke unit where they can access the best professional care can substantially improve stroke outcomes. So we want to highlight with this World Stroke Day 2016 6 key facts about stroke treatment, and if we can all use these facts in our World Stroke Day campaign 2016, we believe we can really make a difference. So the first fact is early recognition, and we particularly use the FAST campaign, face, arm, speech, and time. So just looking at the person, is one side of the face drooping? The person should be asked to elevate their arms, and if one arm drifts or is weak, that's a positive indication. Is the speech affected? Are the words jumbled or slurred? And if there are any of these features, it's time to act quickly. This is an emergency. Please call the emergency services. There are different numbers in different countries, but whether it's 000 in Australia or 911 in the United States, please follow the FAST campaign. And the first principle is early recognition. Stroke is not usually associated with pain, and it's this sudden abnormality in brain functioning that we're trying to teach people to recognise. And the whole thing with stroke is it's sudden, it's dramatic, and it affects the face, the arm, and the speech as principal issues. And then we use the mantra that time is brain, time to act very quickly and call the emergency services. So the second key fact is that we now know that treatment in a specialised stroke unit substantially increases the chance of a good outcome and, in fact, reduces the mortality rate from stroke. The chance of a good outcome is improved by 14% from a package of care that involves a skilled multidisciplinary team involving doctors, nurses, allied health professionals in a geographical stroke unit in a discrete area of the hospital where patients can be looked after using best practice protocols. We have a lot of evidence about how to treat stroke patients, and using that evidence by experienced stroke professional clinicians makes an enormous difference. We get people out of hospital more quickly, we save bed days, stroke units are cost effective, and they substantially improve good outcome. And the philosophy of the World Stroke Organisation is that all stroke patients should be able to access some form of organised stroke care in a stroke unit. We have our own global guidelines where we regard this as the essential element of stroke care, bearing in mind, unfortunately, in many parts of the world, only minimal stroke services are available. And even in those minimal services, putting people in an area where experienced clinicians can look after stroke can improve a difference even without specialised drug therapy. So the third key fact is that we now know that clot-busting drugs, particularly the main licensed drug is, of course, intravenous TPA, tissue plasminogen activator, in selected patients treated within 4.5 hours of the onset of stroke, increases the chance of a good outcome by 30%. I want to emphasize that there are not many medical interventions in internal medicine that improve the chances of a good outcome by 30%. This is really dramatic. And what it means is that because time is brain, we need to recognize the changes of stroke, the symptoms very rapidly, get the patient into hospital. They're usually treated in the emergency department or in the stroke unit. They, of course, have to have a CT brain scan first to distinguish whether this is a ruptured blood vessel, which is a hemorrhage, or a blocked blood vessel, an ischemic stroke, and then provided the patient meets the qualifications, they should receive TPA. In well-organised centres, we can give TPA to about 20% of our patients with ischemic stroke. And TPA has been shown to be cost-effective. It saves money, it saves hospital days, but most importantly, it substantially reduces disability. The next key fact relates to one of the most dramatic changes in stroke therapy, certainly in my career. In 2015, only a year ago, there were 5 major publications in the New England Journal of Medicine, our leading medical journal, that showed unequivocally that in patients with acute ischemic stroke, that is where a blood clot is blocking a vessel to the brain, where patients could be treated within 6 hours with what we call clot retrieval treatments or mechanical thrombectomy. For those patients eligible for this treatment, the chance of a good outcome was increased by more than 50%. The difference this makes is that some people, in fact, come in with a bad stroke, can be treated very quickly, and this clot retrieval treatment is nearly always given in addition or on top of intravenous TPA. And in fact, quite a proportion of patients walk out of hospital a few days later. Most stroke patients, of course, still go on to rehabilitation, but the disability left after the stroke when they've received this treatment is massively reduced. This is an incredible good news story for stroke patients. Now, I do want to emphasize that we focused on 3 particular treatments that are evidence-based and dramatically and significantly improve outcome. I do want to stress there are, of course, many other treatments that we use in stroke units, which are beyond the scope of the webinar today. But in expert centres, sometimes neurosurgery is used, for example, other drugs to treat blood pressure, other drugs to thin the blood are sometimes used. But these are the 3 dramatic interventions that we want to promote this year. So the next key fact is that we should never forget that rehabilitation and working on brain recovery to help the patient regain as much of the function as possible depends on multidisciplinary rehabilitation, and this has to start in the acute hospital as soon as possible following a stroke. We know that rehabilitation improves function and helps the survivor regain as much independence as possible over time. We know that people after stroke, unfortunately, often do have varying degrees of disability, but the disability can be reduced with rehabilitation. The 6th key fact is remembering that people that survive a stroke are at substantially increased risk of further stroke. We know that around 1 in 4 survivors, unfortunately, will have another stroke. Although we're not promoting this specifically this year, the other problem occurring after stroke, apart from another stroke, is that people are at risk of heart attacks and people are at risk of cognitive impairment and dementia. So preventative treatments, secondary prevention after stroke, drugs to lower blood pressure and cholesterol, antiplatelet therapies such as aspirin, clopidogrel, dipyridamole, anticoagulation for atrial fibrillation. We've seen massive advances in this area using the novel or direct oral anticoagulants such as apixaban, edoxaban, rivaroxaban, and dabigatran can dramatically lower rates of further stroke and are substantially better than the standard anti-clotting drug warfarin, although we still use warfarin in some parts of the world. We also know that surgery and even stenting of arteries, ballooning up of arteries, have important roles in stroke prevention. I think finally, just as I introduced the concept that primary prevention, that's prevention at all stages of life. Again, let's emphasize this, and this applies both before a stroke and in stroke survivors. Be physically active. Try and get to a normal weight. We try and counter the Western epidemic of obesity. Be tobacco free. Limit excessive alcohol intake. Reduce stress. Healthy lifestyle, healthy diet, fruit and vegetables really are absolutely crucial to the strategies we have to reduce further stroke. So my take on all this is that we can do a massive amount in stroke prevention, in stroke treatment, stroke rehabilitation, and preventing further stroke. The key message this year is that stroke is treatable, and treatable is really at all of these stages. Please join the fight against stroke. Join us at the World Stroke Organization. We are the global body representing all people affected by stroke and all of us engaged in treating stroke. It is a partnership. It's a partnership between patients, their families, stroke scientists, stroke clinicians, nurses, allied health professionals, and stroke support organisations. Let's try and influence government. Let's try and influence health services all around the world. Let's take action, drive awareness, educate, and push for better equity and access to stroke treatments. Thanks, Vicky.
Thank you, Steve, for taking us through those really important key facts underpinning this campaign. So I'd now like to invite Director of Communications at the Australian Stroke Foundation to discuss opportunities to join the fight against stroke. Thank you, Mary.
Hi everyone, I'm the Director of Communications at the Stroke Foundation, as Vicky just said, and I've also been part of a global working group to develop the campaign, so I'm really excited to see it coming to fruition and for you to be able to see what we've got planned and to help you to turn the facts that Steve has just covered into positive actions to access better stroke treatment around the world. Next slide, Vicky. So at an individual level, sorry, I've skipped one. Sorry, the World Stroke Day is about uniting together in the belief that if we all work together, we can really make a difference to conquer stroke. And this requires everyone advocating and working together to create a one world voice for stroke. So if we all work together at the same time, we can really make a difference. At an individual level, we're encouraging people to act fast, to learn the signs of stroke and know how to take immediate action. And most importantly, we need you to share this with everyone, with your family and with your friends, and with everyone that you know. The World Stroke Organization recognises that access to treatments varies around the world. However, in spite of this, we really want to assist health professionals to understand that with even limited resources, you can really do something. The new roadmap to delivering quality stroke care will be formally launched on World Stroke Day, and will assist clinicians to follow the best practice available to them based on their level of resources and suggest the next steps to strive for improvement. We encourage health professionals to download this roadmap. There are some key actions that we can ask governments and healthcare decision makers to make. We want them to take a leadership role in stroke care by increasing access to evidence-based treatments, to support the development of coordinated systems of care such as stroke units, and most importantly, we really need them to fund our campaigns and to fund research into stroke. Ultimately, we have to activate together. Our new advocacy toolkit will be available in the lead up to World Stroke Day to assist in advocacy efforts to improve access to best practice treatments, stroke units, improved awareness, and much more research. World Stroke Day and the lead up to World Stroke Day is an opportunity for groups around the world to run events or prompt discussion on social media and mass media. And there are a number of examples of things that have been done by other groups around the world on World Stroke Day. And these include things like organising workshops and seminars and conferences, writing articles for newspapers, and this can be opinion leaders from key people in your community. So they could be clinicians or stroke society CEOs or just anybody who can really get the attention of the media. You could develop a TV or radio commercial. We could activate for stroke on the public health agenda. Activate your supporters. Ask them to write to their MPs. We could also do some audits and publish the results to see what's actually happening in the system. And we can establish outreach programs. And if we're lucky, we can even get some new stroke units opening as well. But most importantly, World Stroke Day is the chance for you to leverage off the significant stroke activity around the world to achieve your local objectives as well as the objectives of the World Stroke Organisation. We have developed a range of campaign materials which are available to download from our website as mentioned earlier, and that's at worldstrokecampaign.org, and they include campaign posters, brochures, infographics and various web banners. The resources are being developed into 6 languages in addition to English, and we're actually seeking volunteers to help us provide the materials in other languages. So if you'd like to volunteer, you can email us at campaigns@worldstroke.org, and this email will be shown to you again on the final slide. One of the things that we can all get involved in is social media, and social media plays a key role in spreading the word about the campaign. So if you haven't already, please follow the World Stroke Organisation on Twitter and like us on Facebook, as it's also a key communication method that we use for sharing campaign updates. We encourage you to always use our official hashtag, which is WSD16, so that way we can get World Stroke Day trending again this year as we did in the previous years. We've also in the process of developing some ready-made key messages, some tweets, which you'll find in the campaign called Toolkit Overview document on the website. We're also developing a range of other resources which will be made available in October, and this includes videos, sample press release templates, which you can use on World Stroke Day, as well as the advocacy toolkit and the roadmap, which we mentioned earlier. So now I'd like to hand you back to Vicky to talk about the opportunities to adapt the campaign to your needs.
Thanks, Mary. Ultimately, World Stroke Day is a chance for us to have as many people as possible to be sharing the same messages around the world to ensure the most powerful impact possible. So this year, the message is stroke is treatable, and we need improved access to the best treatment and resources worldwide, regardless of where you live. So you'll be able to add your organisation's logo to our files, which can be requested from the campaigns@worldstroke.org email address, and you can also translate the existing materials into your own language. So please email us if you're interested in in adding to the materials. Otherwise, you're welcome to use them exactly as they are. So we really encourage you to use these materials as much as possible so that we're all united in one voice for stroke. So what are the next steps from here? Well, you should go to our website, www.worldstrokecampaign.org, and download our campaign materials. You can circulate them electronically or print them on either personal printers, or we can provide special files for printing at professional printing companies. And you'll see at the moment there are only the English versions online. However, at the end of the month, the other languages will start appearing online as well. Also, at the end of the month, our event registrations page will open, so at the end of July. So everyone planning an event should use this interactive map to register their event. And your event details and contact information will then appear on our website. So this is a really great opportunity for people searching for events in their region to find your event so that they can take part. And it's also a tool that media organisations use to develop news stories about your event. So please get behind our social media campaign on Facebook and Twitter, as Mary said, and use our hashtag of WSD16. Offer to help with translations. We've actually already had about 5 extra translation offers, so thank you so much. And share the news about World Stroke Day among your networks. We'll provide an official World Stroke Day press release template, and we encourage you to use that. And you can then adjust it with some of your own local stats and quotes from a spokesperson. Ultimately, we really want everyone to make lots of noise on World Stroke Day, so to make our voices heard. Following World Stroke Day, we want to hear all about your great events, so you will be able to share your stories to be eligible for a World Stroke Day award. So we encourage you to also collect some of the key stats and outcomes associated with your events, so including number of attendees, number of media articles, and what the local impact was. And here's a bit more information about our awards. So nominations will close on the 29th of November, so a month after World Stroke Day. And there's 3 award categories, so Individual Achievement Award, Best Campaign in a Low or Middle Income Country, and Best Campaign in a High Income Country. And more information about these awards and previous award winners and benefits to the award winners are also available on our website. So we'd really like to take this opportunity to acknowledge and thank our corporate sponsors for the generous financial contributions which make this campaign possible. Without them, it wouldn't be able to happen. So now's the time to answer your questions. So you should be able to see a question and an answer box in the bottom right of the screen. So if you just type your answers, then we'll be able to answer them for you. And if that's not working, and Steve and Mary, if there's anything you'd like to add while we're waiting for some questions, you're very welcome to.
Well, can I just say I think we're all very excited about this year's World Stroke Day, and as you mentioned, that we value the work done around the world, and we have these 3 special awards for World Stroke Day each year. For example, in 2015, the best campaign in a low or middle income country was awarded to China. The best campaign in a high income country was awarded to Finland. And we had 2 special achievement individual awards. So the awards are featured on our website and our social media. The awardees receive a free annual membership of WSO and access to our International Journal of Stroke, and will be highlighted and acknowledged at our next World Stroke Congress, which is coming up shortly in Hyderabad. So World Stroke Day for us is a big, big deal, and we're so excited and thrilled that you are going to join in.
Thank you, Steve. So if there are any questions now, you can post them in the box. Alternatively, You can also email us your questions, and I've included the contact details for our World Stroke campaign. So there's the email address that we mentioned, our website, and our Facebook page. Also, if we aren't liking you on Facebook or following you on Twitter, please tag us and encourage us to do so, because on World Stroke Day we will be sharing a lot of activities from around the world. So we really encourage, the more connectedness we can have with all of our members, the better, because we want to share and get World Stroke Day trending again this year. So that would be very helpful. So I had a question for Steve.
I'm just getting it going.
So, yes, the campaign materials are being translated, Steve, thank you. So as Mary mentioned, we do have 6 of the core languages already translated and now being converted by our graphic designer, so will be available online next week. And then we also have some other people who have already started volunteering to provide some other translations in their own languages. So that's very helpful.
Can I just ask, Vicky, while we're waiting for questions, perhaps people just put in that chat box where they're from? If we just get an idea of some of the regions in the world that are on the webinar, I think it would be very interesting for us as the presenters. So would you be good enough just to, even if you don't have a particular question, just put in your region in that chat message box? I'm looking at it on the right-hand side of my screen at the bottom. They have to click on the top left, don't they, Vicky, on the chat logo?
I believe so, yes.
You just click on that blue chat logo, top left of your Google Chat screen, and you'll get into the chat room. So to show you how easy it is, I'm putting in Australia.
We've had a few drop off.
Okay.
But it might be that there's some technicality issues. So as I said, you can ask us questions to our email address, or to even Twitter or Facebook is fine. So we did have a question from Mary. How do we get World Stroke Day to trend? Mary, maybe you could tell us.
I just was thinking about that when you were talking about social media before, and talking about making sure that we all use the hashtag, as I mentioned as well. The other thing that we can do is make sure that we follow each other around the world as well. And so when we see each other's tweets and Facebook pages and posts come up, we can share those, and that really helps to get the message that everybody is doing the same thing on the same day. And that really can make a difference, that it can actually get the World Stroke Day hashtag trending, which was what happened last year, which we were really excited about.
Thanks for that, Mary. So I think if that's all, we can probably wrap it up. But thank you very much to our speakers, and thank you to you all for your commitment to World Stroke Day, and we're really looking forward to making it a big success this year. So,
thanks everyone for joining in. Most appreciated.
Thank you.
Bye-bye.
Bye-bye.